Welcome to this video. In this video, we will be taking off the baby in the initial few hours of life. Baby in the initial few hours after the birth. So let me take you to an environment where you have gone or where you might be going if you are anticipating a delivery as a mother, as a woman who will be giving birth or who has given birth to the baby. So you are probably taken to the delivery room by your obstetrician, where she has prepared everything very meticulously and taken all the aseptic precautions to prevent all sort of infections there. So let me take you to a view from a pediatric doctor's point of view. You are ready on the table, on your labor table, while your obstetrician is just working how to efficiently deliver your little one. So here comes the baby. Your obstetrician just pulls very effectively the baby out, and while the baby has started crying and making a few gurgling sounds, the obstetrician, she would just pluck the extra secretions from the mouth of the baby with some bulb sucker sort of thing, and she would put the baby on your tummy. And while she has done this, she would be just doing the other procedures to bring out the placenta and the cord that is along with it. So during this time, these days, what is recommended and what is done by all the doctors is that the clamp is not, the cord is not clamped immediately. The doctors make sure that the cord is clamped 30 seconds after the birth. We say it delayed cord clamping. So how does this help? This helps in a way that extra blood comes from the placenta to your baby, and this extra blood improves the hematological status of your baby. Hematological status means that this baby will be having extra blood to prevent anemia and say a deficiency of hemoglobin in the coming 2 to 6 months of life. And this is a really very effective and proven method all over the world. So once the baby is put on your tummy and 30 seconds have elapsed, your doctor, your obstetrician will just clamp the cord, cut it, and hand over the baby to your pediatrician. So here I am the pediatric doctor. Say I have received your baby. So as a pediatric doctor, I would also be following 5 cleans. So what are these 5 cleans? Number 1, I would be having clean hands. Clean hands, I will be just washing them thoroughly for 5 minutes and then drying and putting on sterile gloves on it. Second C is I will be just putting the baby that I have received from the obstetrician on a clean surface. So this surface is usually a radiant heat warmer, which is pre-warmed, and the surface is preheated, and the linen and the cotton clothes that we place over that radiant heat warmer are again sterilized clean sheets. And at the same time, I would also receive your baby in a say preheated, pre-warmed sterile cotton or towel sheet. So first is clean hands, second is clean surface, third is clean blade. I would cut the cord with clean sterilized surgical blade or with sterilized scissors. Number 4 is I would use clean tie. Clean tie is either I will use a sterilized cotton thread to tie the cord, umbilical cord or I would use a sterilized cord clamp. Right? Number 5, I would keep the cord clean. I would not apply anything on the cord and keep it dry. So these are the 5 C's that a pediatrician follows in the delivery. So at this point of time, the foremost thing that the pediatrician has to make sure is that the baby has come from a warm environment, that is your uterus, your womb, to an environment which is now different from the womb. We try to make the environmental temperature, say the OT temperature or the delivery room temperature, at 24 to 25 degrees centigrade. And at the same time, we put the baby under a radiant heat warmer, which is preset on a particular temperature to keep the baby warm. So what I would do is, as a pediatrician, I would just dry and mop the head of the baby first of all the blood and other secretions that the baby has all around her. So why head? Because head is the largest surface area of the body, and if I start mopping all the surfaces of the body and forgetting the head, so that would not make sense. If I mop and dry the head first, the largest surface area of the body to lose heat is head. So I would prefer to do it. First of all, I will just prefer to wipe and dry the head. I am not going to do it very vigorously. It is just a gentle wipe off, and I will throw off that towel and use a new sheet to wrap the baby, keep the baby warm, and put it under radiant heat warmer. The foremost thing that a pediatrician has to think at this point of time is whether the baby is breathing normally, whether the baby's heart rate is normal, whether the baby's reflexes are normal. This is called APGAR score. This is a bit technical. I'll talk about this in my next videos. So, pediatrician makes sure that the baby is in a absolutely good health. While cleaning the baby, I would not be vigorous to clean off the whitish material on the skin, which we technically call vernix caseosa, because this is a thick whitish material. Sometimes, mothers and the paramedics think to clean it off, but a pediatric doctor will never do it because this is actually protective to skin also, and this will go off of its own with time. So we need not wipe it off. The doctor will clamp the cord approximately 2 to 3 centimeters from the umbilicus, and it should not be long enough to just hang around and touch the genitals, because that would actually contaminate. So we make sure that this cord is clamped just 2 to 3 centimeters from the umbilicus, and we recommend that this cord clamp should be observed for next few hours for any oozes or leaks of blood through it, and that would not be a good idea if we miss this. After just keeping under close observation for a few minutes, we would just put a identity strap over the hand of the baby and transfer the baby to the mother as soon as possible. We call it rooming in. If the mother has delivered normally, we would like to immediately shift the baby by the side of the mother. How this benefits is that this keeps the baby warm, and at the same time this promotes breastfeeding also and promotes bondage with the mother also. So if the case is cesarean section, then probably mother will be going into some post-op or recovery room for a few hours, but at the same time we make sure that the baby stays in the nursery for that period of time, and as soon as the mother is in her own room, private room or ward, we just bring the baby and bring the baby to the mother, so that rooming in begins as soon as possible. Benefits I have told you earlier. The pediatric doctor would record the weight of the baby as soon as he finds that the baby is stable, and he would just grossly check the midline of the baby, and he would do a gross examination of the baby from head to toe and look for any congenital anomalies or some other defects that he needs to know technically. And he would also record the axillary temperature before shifting the baby from the labor room or the delivery room to the mother's room. One shot of vitamin K is given at this point of time, which is very important from the point of view to prevent hemolysis in the baby. When the pediatric doctor comes out of the delivery room, there is a very important communication from this doctor to the relatives of the mother, relatives of the baby. He needs to tell how is the baby, what is the weight of the baby, what is the gender of the baby, and what precautions they need to take when the baby is being handed over to them. At this point of time, doctor also gives a very firm advice to start breastfeeding as soon as possible, because that's the most important thing that's going to build immunity of the baby. So this is all about the baby in the delivery room and first few hours, say. So in the next video, we will be going the first few hours and beyond. And before we move on to the next video, I want all of you to write down your experience that you have gone through while delivering your babies, and that's going to be a very interesting exercise. You can put forth in the best and the most emotional and beautiful words that you have always wished to do that. Let's do it.